Sustain 267.
Welcome to the Sustain 267 feature, where we talk about everything climate change, environment, and sustainability on Yarn FM. The 7th of April marked World Health Day, and today we'll be talking health and climate change. Around the world, the right to health of millions is increasingly coming under threat. Diseases and disasters loom large as causes of death and disability. Conflicts are devastating lives, causing death, pain and hunger, and even psychological distress. Burning of fossil fuels is simultaneously driving the climate crisis and taking away our right to even breathe clean air, with indoor and outdoor air pollution claiming a life every 5 seconds. To address these type of challenges, the theme for World Health Day 2024 is My Health, My Right. This year's theme was chosen to champion the right of everyone, everywhere, to have access to quality health services, education, information, as well as safe drinking water, clean air, good nutrition, quality housing, decent working, and environmental conditions, and freedom from discrimination. In today's episode, we talk to Dr. Vincent Bagiwa, who is the Public Health Research Fellow at the Okavango Research Institute at the University of Botswana. Doc, we're talking about health and climate change. What's the relationship between the two?
Climate change presents a fundamental threat to human health. And as climate conditions change, we expect more frequent and intensifying weather and climate events which can be observed, such as storms, extreme heat, floods, drought, and wildfires. These weather and climate hazards affect health both directly and indirectly, which end up increasing the risk of deaths, non-communicable diseases, the emergency and spread of infectious diseases, and public health pandemics, as we have seen with COVID-19. Climate change is also undermining many of the social determinants of good health, such as livelihoods, equality, and access to healthcare and social support structures. These climate-sensitive health risks are disproportionately felt by the most vulnerable and disadvantaged people, such as the poor communities who sometimes have to spend most of the time working outdoors, the elderly people, and those with underlying health conditions. Climate change is also having an impact in our health workforce, the infrastructure, and also can reduce the capacity to provide the universal health coverage that we anticipate.
You talked about indirect and direct causes. I think the statement you gave was rather general globally, but in Botswana, how do we anticipate seeing the relationship between health and climate change manifest in our day-to-day lives?
That is very correct. Climate change has become a global health crisis that threatens the well-being of the vulnerable populations, like I said, and Botswana is not an exemption. In Botswana, the most events which I would like to highlight, which are linked to climate change, are heat waves, floods, and droughts. Heat waves has a direct link to climate-sensitive pathogens such as malaria, and recently there are cases of malaria in areas which were never prone to malaria before in Botswana, which is also causing a serious concern. Floods also increases the frequency of waterborne diseases outbreaks, such as diarrhea and schistosomiasis, especially around the Okavango areas. And also with the current El Niños, temperatures has risen to a maximum of 42 degrees Celsius in Botswana, especially around the Ngamiland and Chobe areas, which also have lasted for days more than ever before. So these extreme heat events have a direct impact on people's health and can cause problems such as heat strokes, especially among the elderly, and fever of unknown origin in babies, and also complications for those who are living with chronic conditions. So it is very important it is important for Botswana to start building resilience to mitigate this impact of climate change on health.
Thanks, Doc. You started on the call to Botswana to start building that resilience. My last question is, the theme this year was My Health, My Right. How can we champion Botswana's right to health in the face of the climate crisis as individuals, as institutions, and as the country?
Thank you for that question. That's a very important action question. Climate change impact on the health of people is already evident. There are no questions or doubts about it. And our actions need to be imminent. Further delays in tackling climate change will increase health risks, will also undermine the decades of improvement in our health systems. Botswana has one of the best health systems in Africa. So if we don't quicken our actions, then we are going to undermine those efforts that we have built for so long. And also our delays may contravene our collective commitments to ensure the human rights for all, like you have mentioned. So we need collaborative efforts. First of all, we need to embrace both government initiatives together with evidence from climate scientists, public health researchers, and also the voice of the community in designing the most suitable health adaptation interventions or actions for strengthening our health systems against climate change health shocks. So the community also should always be vigilant to the early warnings which are issued against climate change events. We have always seen with heat waves where people are being given instructions on what to do, on precautions to follow to protect themselves against possible harm from such extreme weather events. So you always say prevention is always better than cure. So that's my take.
Doc, thank you so much for sharing that and the call for action.
Thank you so much for the invitation. It's my pleasure.
All right. And if you'd like to listen to longer versions of this and learn more about climate change, sustainability, and environment, listen to the Sustain 267 podcast, available on your preferred podcast platform and on our YouTube page. Also follow us on social media to keep up to date with conversations, just like if you're looking to be active, if you're looking to take action and champion climate action, follow us on all our social media, Instagram, X, formerly known as Twitter, LinkedIn, and Facebook at Sustain267. My name is Patekile Sitse. I have been your host, and catch you next week.
That was Patekile Sitse, host and founder of Sustain 267, that happens every single Wednesday right here on Yarne FM.